Brain Injury Alliance webinar on clubhouses and how they work for people with brain injury. USBIA is an alliance of states across the nation that have formed to focus on the expressed needs of people with brain injury and their families in order to develop services and supports. We primarily focus on the long-term life after brain injury, while we also stand ready to help people navigate the whole range of acute care, post-acute care issues, choosing rehabilitation, trying to parse out new possible novel technologies that are always out there, and balance decisions with hard decisions early on and throughout life. Many of our organizations, brain injury alliances and brain injury associations, are an anchor for families in order to get rapid, reliable, and relevant information. Not to say, Thomas, that people shouldn't be skeptical. I think we all have to be reasonably skeptical because not every treatment, not every service, not every provider is a match for every person with a brain injury. There's a lot of diversity in the brain injury world and community. But that said, there are some really great models that are worth trying. And that's what we all do. I'm a family member myself. I'm a father of a 22-year-old daughter who's had a brain injury. She's doing great, but it's a lifetime of effort. And I graduated to getting my Christmas present 2 years ago, which was the BIB on a sweatshirt. When I asked what it was, it says, "You're the brain injury bastard." And so, you know, it's a badge of honor. So what is an ABI Clubhouse? Let me just start there and we'll get right into it. It's a supportive community of people living with brain injury related disabilities who collaborate in a work-oriented environment. And today we are lucky to have Cindi Johnson, who's got a master's and as well as a certified brain injury services trainer. She's executive director of the Side by Side Brain Injury Clubhouse in Stone Mountain, Georgia. She has her degree, a master's in psychology with a focus in behavioral neuroscience from Georgia State. And that was after 15 years as a COG rehab therapist and administrator in post-acute rehabilitation. She's got a passion for supporting people with brain injuries and in the development of the Clubhouse Model Program, which is focused on lifelong psychosocial, cognitive, and vocational support, and dare I say, fun. To some degree, fun. The Side by Side Clubhouse opened in 2000 as the only program of its kind in the Southeast US for people who had disabilities from brain injury. I'm going to also introduce Colleen McKay, who is also a master's trained and assistant professor and director of the program for Clubhouse Research, PCR, in the Department of Psychiatry's Systems and Psychosocial Advances Research Center at University of Massachusetts Med School. Her background is in rehab counseling over 30 years, and she's got that many years of Clubhouse experience with Clubhouse model programs. As the program for Clubhouse Research Director, she coordinates and oversees the development of an agenda of Clubhouse-related research projects, technical assistance, and consultations to Clubhouses, mental health administrators, researchers, and basically anybody who can get a hold of her. She's focused on working on peer-reviewed journal articles, manuals, and toolkits. Her interests include recovery, VR, vocational rehab, and health promotion issues for adults and young adults, particularly in and around the Clubhouse model. I'll just say she's a co-investigator on evaluating brain injury clubhouses and their effects on neurobehavioral functioning and participation, which is a federally funded project, if I'm not mistaken. So Cindi and Colleen, let me welcome you on behalf of the United States Brain Injury Alliance, and please take it away. I'll moderate in and out, and we have some questions that are already coming in, so I may be bold to interrupt you on occasion.
Great, thanks, Jeff.
Yep.
So I'm Cindi Johnson, and I'm going to start out today talking a little bit about the Clubhouse as it relates to brain injury. And we're going to present some exciting data to you today of a project that we just finished. We're still analyzing the data to show that clubhouses really do work to improve the lives of people with brain injuries. So I'll give a little intro, and then I'm going to toss it to Colleen to talk about the data. And then we'll come back to me to answer most of your questions. A lot of them should be answered as we present the data. And I have a couple of slides with questions listed on them that we received from the registrants of this webinar through yesterday. So we're going to get to everything. And if we don't have time before we end, you can email me, and Colleen and I can both stay on for a while if you want to hang around to get all your questions answered. So Colleen, you want to, there we go. You want to advance it one more? Okay, so the study that we just finished is a multi-center study of 8 different clubhouses around the US. And it's funded by the state of Virginia. Unfortunately, it's not federally funded. I say unfortunately because when we get that big and that we can rate federal funding, we'll have all kinds of empirical evidence. And the state of Virginia, in essence, invested in looking at their return on investment because they're the only state that we know of that actually funds brain injury clubhouse programs through the state budget. And so Jason Young in Richmond is the principal investigator on this. And then we also partnered with VCU and Dr. Ron Seal and Colleen, who's on right now with the University of Massachusetts Medical School. And I was simply the person carrying the torch for 20 years to beg for outcome studies, and then the liaison between the study sites and the researchers. So you want to go one more, Colleen? These are the study sites, and we don't need to go through all of those. It was all of the Virginia clubhouses, all 5 of them, and then brain injury clubhouses in 3 other states. Now, Jeff already gave a good intro about what a clubhouse is. And since we're going to spend a lot of time on the data today, I'm going to have to cut short my usual hour to 3-day discussion about what a clubhouse is that I learned from Harvey Jacobs, who is the most passionate clubhouse advocate I ever knew myself. So Clubhouse started actually in 1948 by and for people with mental illness who wanted a way to keep themselves out of the hospital. And they soon discovered that they needed a little bit of help, that they couldn't do it alone. So they actually hired a staff member. And eventually that became known as Fountain House, which was the first clubhouse, and it's still going on in Manhattan. And I think it serves about 300 members a day. And then through that, Clubhouse International developed as a coordinating body of mental health clubhouses. And Clubhouse International has helped the brain injury clubhouse world tremendously in supporting us in developing this model and adapting it for use with brain injury. So over the last 25 to 30 years, this has been adapted to brain injury. And right now we have probably about 20 brain injury clubhouses around the world. You probably, well, and most of them in the US, you probably wonder why so few. And the short answer is funding. And we follow a set of standards called the Clubhouse Standards, and we adapted those for brain injury too. And you can find those on a website that I'll give you the address for in a little while. But we follow standards that kind of serve as a bill of rights that make sure that this program is member driven. The people who come to the clubhouse are clubhouse members, they're not patients. And it's built around, to me, 2 basic premises. One is partnership. Everything is about partnership between members and staff, members and members and anybody else, volunteers or anybody else who might come into the clubhouse. And the members make decisions and are involved in every single aspect from hiring staff to setting policy. And they actually complete the work of the day, and that leads to the work order day. So instead of a day program where you might come and play games and do arts and crafts, we actually do the work that it takes to run our clubhouses. So we're answering the phones, we're cooking lunch, we're writing thank you notes to donors, we're taking care of the building, we're doing all those kinds of things, and following the hours of a work order day. Once you're a member of a clubhouse, you're a member for life. That's very different from rehab, and everybody is included. It's about, you know, no matter how old you were when you got your injury, no matter where you live or what career you had, you're still accepted and valued for the strengths you bring today. And then the peer support is, of course, the most important part of a clubhouse model. Everybody brings their strengths and talents, and that's what makes the clubhouse run. So we divide into work units in a clubhouse, and we you know, work together to make sure everything's done day to day. And in addition to that, the Brain Injury Clubhouse helps with a wide array of services that you can see below. And the reason this works so well in the clubhouse is because of the relationships that develop naturally when you're working side by side with somebody in a work unit. You become, you know, you have a trusted relationship so that you can help, a staff member can help somebody with life skills and with family support. We have a huge focus on health and wellness in the clubhouse, and you're going to hear about that when we get to the data. We also focus a lot on employment, and all clubhouses help people in some way to employment. Some are a program of a larger auspice agency that does supported employment, so they might help people get ready for employment. But the true clubhouse model has a whole continuum of employment services, and that people, even when you're employed, you're still a member of the clubhouse and come back for support. So you might have some more questions about that later, but if they're not answered when Colleen goes through the data, I'll be sure to get to them at the end. Okay, next slide. So this is just to give you the email, the website address of the International Brain Injury Clubhouse Alliance. This is a totally volunteer organization that coordinates questions and answers, development of new clubhouses, sharing ideas and supports for brain injury clubhouses. So the starting a new clubhouse section of this is being updated today. And so by tomorrow, you should be able to get the newest information, because I saw that a lot of your questions were about how to open new clubhouses. And you lucked out today in that the person whose name is on the website to ask more questions about opening clubhouses is yours truly. And here's my email address, and you can also get it on the website. Okay, Colleen. So at this point, I'm going to transition over to Colleen and just let you know that, well, I've already talked about this, about why we set this study up. And we are so excited to share the results with you today. And I'm especially excited that, again, I said this earlier, and Harvey emailed that he doesn't have a microphone or a camera on his computer that he's using, but I hope that he'll be proud of what we've done when he sees this evidence, because he helped us get started the first brain injury clubhouse way back in the 80s. So I'm going to turn it over to you now, Colleen.
Thanks, Cindy. Good afternoon, everybody. This afternoon, we'll be talking about two main pieces from the research project. One is from an electronic database that we implemented in the brain injury clubhouses. This really looks at program level characteristics of clubhouse programs. The CPQ, or Clubhouse Profile Questionnaire, was originally developed in and for clubhouses serving individuals with mental illness, and as the research project, we tailored the instrument for the brain injury clubs. So a big thank you to all 8 of our Clubhouse partners. They had a lot of input and feedback into the items and tailoring of the instruments. We did try to keep as many elements in the CPQ consistent with the existing database that's used in the mental health clubhouses, because it allows us to begin to look at and understand similarities and differences in the clubhouses and the populations that they are serving. The second part of the research was led by Dr. Seal at VCU, looking more at the impact of membership, so outcomes on an individual level around clubhouse membership and neurobehavioral functioning. Using several instruments, including the safety assessment measure, which was developed by Dr. Seal, the Mayo Portland Adaptability Inventory, and the CDC Healthy Days measures. So we'll go through some of the results from the CPQ, and then I'll go into information from the SAM and the MPAI. CPQ, once again, just it looks at all sorts of things related to the Clubhouse program. So its funding structure, its how it's governed or operated. So, you know, things like, does it have an auspice agency or a parent agency overseeing the program? Things like membership, how many members participate in the Clubhouse? How many staff does the program have? What kinds of services are provided? What happens in the work units in the work ordered day? And then things like whether or not the Clubhouse is doing any work around Clubhouse training or research. As Cindi mentioned earlier, Clubhouse International is kind of the globally the coordinating and accrediting body for the mental health clubhouses worldwide. They use the information for purposes of quality assurance, so for their own accreditation process, for program improvements, to be able to look at the progress of not only accreditation training, but the development of the model over time. So looking at the characteristics of the 8 Clubhouse partners, these programs have been in operation about 14.5 years. That's not as long as mental health clubhouses in the United States. About 1/4 have a board of directors and 40% have an advisory board. Typically, we would see an independent board of directors in a program that's a freestanding clubhouse that doesn't have a parent agency or auspice agency. Those programs with parent agencies are more likely to have an advisory board. All of the partners and clubhouses that we're talking about this afternoon belong to IBICA, so they all belong to a coalition. As you can see, almost all of them do have a parent agency. About 5 full-time staff and a member, and this would be active member to full-time staff, member to staff ratio of about 9 active members to 1 full-time equivalent staff. That's about half of the size of the ratio that we would see in a mental health clubhouse. Looking at CARF accreditation, the brain injury clubhouses are much more likely to have a CARF accreditation than the mental health clubhouses would be. If they have a CARF accreditation, it's most likely under the employment and community services category. How are these programs funded? And here, this funding is averaged across all 8 programs. The The largest category is from state or local government. So in Virginia, their funding comes from the state, but in other places, like with Cindy's Clubhouse, that they may get funding from other sources. So there's wide variability from state to state in how the clubhouses are funded. That's also true for mental health clubs, although the mental health clubs, about 35 to 40% of them have the ability to bill Medicaid for clubhouse service. So how do members get to the clubhouse? As you can see from this busy chart, all sorts of ways, whether it's a referral from the case provider, a case manager, family members, care providers, a brain injury affiliate or rehab agency, and they can self-refer other members. So all sorts of pathways that members use to get to the clubhouse. Members, and this is the active membership in the clubhouse. So about 2/3 male. Once again, kind of over the lifespan, so we have younger members, middle-aged members, and older members participating in the clubhouse. This looks very similar to what we see in mental health clubhouses as well. We asked the clubhouses to report on their membership and how long it's been since they had their injury. And as you can see, for some cases, it's been a long time since the member had the brain injury. So clubhouses are really supporting people over a long time. It's not like that everyone just got out of the hospital or anything like that, or out of long-term, short-term rehabilitation. In terms of ethnic groups, these are the active memberships, and it's the number of active members. So primarily white, Caucasian, Black, African American, or Hispanic or Latino, small percentages of Asian and Hawaiian and Pacific Islander. This looks a little different from the mental health clubhouses, but mental health clubhouses have programs in Hawaii, Alaska, and Asia. In terms of diagnoses, 60% have a traumatic brain injury, 40% non-traumatic. 57% of active members also have comorbid health issues. And when we get into a few of the slides that Dr. Seal's project, we'll get into a little more detail around that. So looking at the cause of the brain injury, 40% vehicle crash or accident, 20% stroke, just under 10% from something like a fall, 9% from some sort of violence, and the other 21% is from a variety of other mechanisms. Where do clubhouse members live? The vast majority, 60%, live with family members. 17.5% live on their own. Another 17% live in group housing. This is one of the areas that we see looks very different from the mental health clubhouses, where members would be more likely to be living independently or in group housing, particularly for clubhouses within the United States. In terms of transportation, so how do members, once they're referred, how do they actually physically get to the clubhouse? 37.5% disability transportation, and a little over 27.5% paratransit. Once again, these are categories that you wouldn't even see in the mental health clubhouses, where their members would be more likely to be relying on a vehicle or public transportation, or perhaps a club van. So then looking at participation, and these are the averages across the clubs. So about 17 members a day, but you can see really there's wide variability in these clubs, that some are much smaller than others, so anywhere from 8 to 29 members a day. Active membership, and that's typically either anyone who attends at least once a month. In some cases, it's once every 90 days, but about 45 members. Total membership is over the lifetime of the clubhouse, so about 267 members since the clubhouse opened. And once again, you can see there's a wide range in membership. Some of that is reflective just in how long some of the clubhouses have been open as well. As Cindi mentioned earlier, in terms of the standards, most clubhouses offer lifetime membership. That doesn't mean somebody is expected to attend for the rest of their lives, but certainly the clubhouse would be available to them if they needed and wanted those supports. The other thing in the last row that you would see in a brain injury clubhouse that we don't see as much in the mental health clubhouses is having some personal support or personal assistance. And that's really just due to differences in the populations being served in the two types of programs. So what happens in the work order day or in those work units? Cindi already touched on this, but just a few more examples. The one really just, I think, highlighting today, particularly with the COVID pandemic, is outreach. So clubhouses will actively reach out to members who are unable to attend to the clubhouse, checking in on them. Are you okay? We miss you. And really maintaining contact with those members even when they are physically unable to get to the club. In terms of the different types of services the clubhouses offer, as you can see, it's a really lengthy list. The blue bars are the services offered by staff. One of the things that makes clubhouses unique from other programs is that members also support and can provide services to other members as well. As far as the slides, some of the things, once again, that we see that's a little different between the brain injury clubhouses and a mental health clubhouse is family supports. We're much more likely to see those in the brain injury clubs. The same thing with coaching. Whereas I think a mental health clubhouse, you would see more around education and supported education linkages. In terms of vocational supports, because a lot of the emphasis in and around a clubhouse program is work, whether it's being involved in the work or the day or work in the larger community, there's a lot of supports around working. For this case, we asked the clubhouses to report on all sorts of different types of employment that might be offered by a clubhouse, things like transitional supported, independent employment, customized employment. Supported employment was the employment type that was offered by the majority of the 8 clubhouse partners in this project. And as you can see, things like help with job hunting, life skill training, and work readiness assessments were offered by at least half of those programs. And then the other supports really vary from program to program. So my email is there. If you have more questions about the CPQ that we don't get answered today, feel free to email me at the address there. I would advise you not to call right now because I don't know when I'll actually be able to be physically back in my office to answer the phone, but I can certainly respond by email. And at this point, I'm going to shift and share some of the findings from Dr. Seal's project. Cindy mentioned Dr. Seal's at VCU, and in his piece of the project, they're looking at new members in the Clubhouse. And as you can see, it looks very similar in terms of the breakdown between male and female. Average age 41. He also has some information here about education for the Clubhouse members. So about 41% have completed high school, 12% have an associate's degree, 16% bachelor's degree, and another 17% have some sort of vocational training or college credit. More around the brain injury, the causes of brain injury, a little bit more detailed breakdown here than what we have in the CPQ. And you'll note there too, average time since injury, 13 years, but really a broad range from less than a year to an individual whose injury occurred 63 years ago. One of the things that they looked at were the comorbid medical conditions that members have. As you'll note there, this was done by self-report, but high rates of depression. And under other, anxiety disorder was also listed a number of times. One of the interesting things that we're learning in this project is really some of the overlap between medical conditions and the populations being served by the two different types of clubhouses. I think going forward, the clubhouses will be able to do some cross-pollination and really begin working together and collaborating and forming one another, even though they're serving two different groups of people. There's some real similarities across populations being served. Reported impairments, and these are from the Mayo Portland. Dr. Seal's team only collected the subject baseline responses that were moderate, severe, or severe interference with the following aspects of life. The majority of participants have expressed the most interference, moderate or greater, with memory, 60%, attention, 51%, followed by novel problem solving at 45%. Also, just as an FYI, some members had caregivers participate in the baseline assessment, and they gave staff, Clubhouse staff, at least 2 weeks to get the answers because of the member's severity of injury, allowing them for a more accurate baseline assessment. Looking at chronic conditions, as you heard me mention earlier, and from the CPQ, a lot of members have some other comorbid medical health condition. Here, you can really begin to see the extent of the number of those conditions. There were a substantial number of individuals with anywhere from 5 to 12 chronic conditions. This, I think, is important to think about for a couple of things. One, kind of the complexity and challenges that clubhouses may face in supporting members with a diverse group of needs. but also thinking about in terms of funding, that payers often look at things like the functional impairments, medical conditions, and comorbid mental health challenges. So beginning to look at the 6-month outcomes, and all of these should be considered preliminary, all of Dr. Seal's slides that we're sharing with you today. So they had approximately 100 people, 75% agreed to participate in a 6-month follow-up. 13 discontinued their membership with 3 or less post-line visits. 9 of those only had a baseline visit. They were significantly more depressed at baseline. And there were no other differences in baseline in access to transportation, medical conditions, risk for hospitalization, abilities, or participation. They had 14 lost to follow-up. Those individuals had significantly fewer Clubhouse visits than those who they were able to follow up with at 6 months. So in terms of hospitalization risk outcomes, this is from the CARE tool. One of the things they modified here was looking at the risk factors over the last 3 months rather than 6 months. There was a substantial and significant reduction in risk factors. And this is really important outcome, again, just because hospitalization risk is important to payers, certainly be of concern for providers and family members as well. There were 15 in terms of depressive symptoms outcomes, 15 reporting symptoms consistent with major depression at baseline, only 9 at 6 months, which is a statistically significant reduction. In terms of health life quality outcomes, T-tests were used for simplicity. But once again, the general health in the last 30 days was significant. Here, members' poor health restricted activities significantly, which were different at baseline to 6 months, despite their actual health not changing much. Dr. Seal has indicated this is one of the most important findings of his project. There may be aspects of the Clubhouse where participation helps members be more resilient. So even though their health didn't change drastically over the 6 months, their ability to participate or be less restricted in participating in activities did change. In terms of the MPAI abilities outcomes, here the categories were split out. Once again, a significant finding in the ability scale score. And this really reflects the last slide too in the impact of the program, helping members develop confidence in doing new things, remembering what it is they're supposed to do. So some signs of functional improvement. Here we see a real improvement in participation as seen with initiation at the extremes. So 7 at baseline and 0 at 6 months. Once again, showing some improvement towards independence. With transportation, we also saw an improvement, which was very exciting to see. Transportation, for thinking about additional services within the Clubhouse that could potentially be funded, transportation might be one that would be good to have as a formal Clubhouse service. And then looking at leisure and recreational activities. So at baseline, 11 individuals had less than 25% normal interaction. That went to 1 at 6 months. And social contact went from 13 at baseline to 1 at 6 months. So just to summarize those, so changes, reduced changes in number of hospitalization risk factors, depressive symptoms, and impact of poor health on daily activities, improvements in general health, in abilities, things like attention and memory, and improvements in participation, initiation, activities, and social aspects. Dr. Seal's email address is there, so if you have specific questions about his study, I would email him directly. I'll just leave it there for a minute so you can take down his email, and then I will turn it back over to Cindi.
Okay. So we're excited about this data, even though it hasn't been even fully analyzed yet, because one of the things that people ask us when they want to start a clubhouse is, how do I show potential funders that this works? And our answer is always, take our word for it, ask our members. But now we have some proof that even though, especially for those members who've been injured for years and years, even though they might not be physically getting better or even mentally getting better, they're having fewer days a month that their activities are impaired. And so they're still getting up and getting to the clubhouse or being active at home. They're also a lot more active outside of the clubhouse. And so, we couldn't really ask for much more than that. It really helps families stay together and be healthier. So we're really thrilled to finally get these results. So I'm going to move on now to answer some of your questions. These are some of the questions that you submitted on your registration. And I'm not going to be able to look at the chat while I do this because I have poor divided attention. So I'm just going to minimize that. And get through as much of this as I can. And Jeff, feel free to interrupt me or, gear the discussion in a different direction if you feel like it needs to go there. The first question, what's the number one thing you would suggest to somebody opening a clubhouse? And that would be set up a work group and visit an accredited clubhouse. And by that, I mean a mental health clubhouse that's accredited by Clubhouse International, or a brain injury clubhouse that's accredited by CARF. The mental health clubhouses are very strong programs. And for the most part, when people ask us about starting a brain injury clubhouse, they are professionals in brain injury, either because they live with one or they support somebody with one. And so it's not the brain injury that people need to learn about. It's about the clubhouse model and often how to set up a nonprofit organization or ally with another provider so that they could help you start the clubhouse. So I would say get a strong work group. And this is on the USBIA website on the questions about the suggestions about how to start a clubhouse, is you want to have stakeholders from at least 3 or 4 different areas, like a funder, a member, a professional, an accountant, a community member, an employer. You want to have people with different skill sets who will really stick with you while you navigate trying to get all the infrastructure set up. How do we determine who's allowed to participate?
Let me jump in, Cindi, let me just jump in with a follow-up to that. So thank you. There's a question from some of us out here in rural America. Do you see a population density relationship, kind of a minimum number of well, put it this way, urban versus ruralness between clubhouses and their success? Meaning, do you need a base for both, for example, vocational, VR, vocational, and program support, volunteers, fundraising, and clients? Is it your sense that you should try not to start this out in a community of 500?
Yes, yes. Generally, communities of about 150,000 or more can best support a clubhouse.
Thank you.
Although we have seen them develop where communities will kind of coalesce together to open one that's centrally located.
Okay.
And then, of course, transportation is an issue. But even in ours in metropolitan Atlanta, our members travel, some of them travel 2 hours one way to get to the clubhouse.
Wow. Thank you.
So it's a big education for people to understand that if you have one anywhere nearby, it's worth it to try to get there.
Yeah, thank you.
Yeah. So eligibility is determined differently at different clubhouses. One of the differences between a brain injury clubhouse and a mental health clubhouse is that we generally do require that people are independent with their assistive devices before they can come. So whether that is medication reminders to take their medication or their wheelchair, eating, toileting, those kinds of things. And they're also welcome to bring a personal support person with them. The clubhouse staff don't provide that themselves. If we did, we would begin to vary from the model of working side by side, and we would be caring for people, physically. And that's the biggest eligibility determination. And I would say also that people are in control of their behavior so that they're not a threat to others, and that they are interested in productive activity that works towards a common cause. And that is, again, one of the beauties of Clubhouse is people might not have that while they're at home when they're the only person who's being cared for. But when you come into a clubhouse, you find that your strengths are needed by somebody there. And so everybody finds a reason to belong and contribute. Otherwise, as far as eligibility, I think it varies clubhouse to clubhouse and sometimes based on the funding. Sometimes clubhouses are restricted to only offer to people with traumatic brain injury versus acquired brain injury, that kind of thing. But in general, we don't discriminate at all for diagnosis. And I'll say that while this isn't an eligibility criteria, that if you're familiar with the Rancho scale, generally a level 7 and above tend to do the best in a clubhouse. How the model can be utilized by a support group that's not connected with a BIA organization, well, I'll just tell you that none of them are. And so there's the answer to your question is it's really about setting up a clubhouse model and the infrastructure to have either a nonprofit organization or run a program that's associated with a sponsoring agency. So you really just need a strong work group and a way to get funding and to sustain that funding.
Cindi, quick sidebar.
Yes.
So we have in Iowa, there's a clubhouse startup that is
Empower House.
There you go, Empower House. Is there a downside that you discern to a BIA being a sponsor or a governing body for a clubhouse?
There is not, theoretically, as long as that association is committed to the clubhouse standards.
Yep.
We've had some clubhouses fail that were associated with state associations that might have gotten a grant to start a clubhouse, but then they didn't have the money to sustain it. And they didn't want to continue to invest in the clubhouse. And then they wanted to start determining who needed to be served and how they needed to be served. And the clubhouse needs to be able to decide that itself.
Got it. Thank you so much.
The credentialing issues, yes, they need to be considered state to state. Some states have no credentialing issues or requirements. Others do. Our state, just in the last few years, began requiring us to be licensed as an adult day center, even though we're also providing vocational services and home-based life skills services and that kind of thing. So it varies state to state and who the funder is. A lot of clubhouses are funded partially through state Medicaid waivers, and there's usually some credentialing associated with that, and also through vocational rehabilitation, and sometimes there's credentialing associated with that. We have found that CARF is an excellent way for us to make sure that we are following best practices, and that many of us are even voluntarily CARF accredited for that reason, so that we can kind of set the standard. How long does it take to operationalize a clubhouse model? That would vary, again, depending on your work group, your community support, and the funding structure. I would say anywhere between 1 and 5 years. The program in Iowa, who I've been a mentor for a couple of years now, it took them probably 2 or 3 years. Valerie's on the call now, and she can talk to that. I think they probably have been going at this about 5 years until they felt like they were, just fully a strong daily operating clubhouse. Who makes decisions about what goes on during the day? That's the best question of all. It's the members and staff together, and it's done by consensus in a clubhouse. The only time in our clubhouse that's not the case is if there's a safety issue or a significant cost issue, and as the director, I may veto a decision. But that is the crux of the model, is that it's a partnership model and the decisions are made together. Someone asked, I kind of combined 2 questions here about how they could better advocate for medical and mental health care and their own mental health. And so this picture on here is a picture of our clubhouse at our state legislature, just a couple right before COVID hit. And the best way to advocate is to organize and do it as a team and be ready to tell your story to your elected official, because they remember the individual stories. And that's where a partnership with the state affiliation or association can really help you too. But I have been surprised, as have my colleagues, on how effective advocacy is for policy change and funding changes to serve people with brain injuries. Okay, Colleen, you want to hit the last slide? So these are the funding questions that I got. And over on the right side, these are just some photos from our clubhouse. And I just want to go through them just a little bit to give you a flavor of what really goes on in a clubhouse. The top one is a couple of people reconciling lunch funds and our member bank funds together. And then a member in the maintenance unit doing the daily vacuuming. And the third one is is a group of members who were interviewing a potential staff member. So they were meeting ahead of time to review interview questions, and decide, how they were going to go about that. It's very empowering to see that happen. So back to the funding questions, the cost breakdown. Well, I could talk forever about that, but I would say that from between about $200,000 and $500,000 is probably about the average range for startup. There's a variation that depends on what kind of space you might be able to get. Some programs get a donated space, at least to start with, and some, are customizing and renovating their own office space. Staff costs are probably going to be will be the highest proportion. Our staff cost here is about 75% of our expenses, but we own our own building. So I'd count on about 70% of the costs being the director and the staff, and you need to start at least with 2 staff, a director and a staff at least. You want a backup on site in case something happens. And then the occupancy costs would be the next. And then getting down to supplies and computers and software and that kind of thing make up the rest of it. The startup, again, I know I'm perseverating on this, but the startup is just the beginning. Before you even think about getting going, you need to know how you're going to sustain that, because the last thing you want to do is get everybody's hopes up and have a great time and make great gains in their lives and then say, oh gosh, now we have to close because we don't have a way to keep things going. What are the reimbursement options available for owners? Well, the clubhouses that we know about don't have owners. They're all not-for-profit organizations. And maybe 1 or 2 might be a program of a for-profit organization. But generally that's hard to do because, again, the owners want to influence the program rather than following the clubhouse standards. And maybe this question was getting more at what the funding streams are. And so I'll talk a little bit about that since that's the next question. And that varies widely from clubhouse to clubhouse and state to state. When Colleen mentioned that I would say the majority, at least in the US, of mental health clubhouses get funding through Medicaid, it's generally through their state Medicaid plan. And as everybody on this call knows, that state Medicaid doesn't cover long-term supports for people with brain injuries. And so Medicaid waivers are a way that many of us get some funding. It certainly doesn't cover our cost. Here it covers about a third of our cost to provide the service each day. Vocational rehabilitation, almost all of us are vendors for our state vocational rehab office. And we bill at Side by Side, we bill a fee for service to, on a sliding scale, to those who don't have an outside payer source. People might pay anywhere between $1 a day, and if they have a huge trust fund, they might pay our cost of providing the service per day and anything in between that. But right now, our private pay ranges, our average is about $17 a day. Many clubhouses don't charge at all if they're state funded. All of the Virginia clubhouses are about 90% state funded through their Commonwealth Neurotrauma Initiative. And we all should, take heed of Virginia and lobby or I shouldn't say lobby, we should advocate in our states to have designated TBI funding for programming and case management services like Virginia has. We're all jealous of them. And then in Georgia, we get a good bit of our funding through workers' compensation carriers that fund services for injured workers. And we can provide that service about 1/7 of the cost of a day of a rehab program during the day. Otherwise, we're all fundraising. Some of us have dedicated development staff and some of us don't, but we're writing grants constantly and sharing resources for funding that way. I would say anywhere between about 10% and 100%, depending on the clubhouse, of funding comes through fundraising. Do state or federal funds pay for programming? I just talked about the state fund options. Sometimes in Georgia, after 20 years, we were just granted a small amount of general funds from our state, and I modeled that after the Virginia movement. But I don't know if that'll be taken away now that COVID has happened. Federal funds do not pay for clubhouses, except if you want to count the pass-through funds from Medicaid and vocational rehab. And is it desirable or not? That's a great follow-up question, because you want to have a diverse funding stream, if at all possible, in a clubhouse, and not rely on a government source that can change when an administration changes. So yes and no, the answer to that is. And I think there was one other question that came through today that I'll address, and then we're right at the end of time, but we'll stay on if you have other questions, is how have we adjusted to, have we done Zoom through COVID? Yes, we've all done Zoom. We're all doing it, and it's great in that it's engaging members that we might not have seen in a while, but we're also starting to see kind of it wind down in that people really need the face-to-face on-site support. So we will continue doing it even as we begin to gradually open up, but it's not for everybody and it's not for everything. So with that said, does anybody have any other questions, or do we need to sign off?
I'll tell you what, Cindi, we do need to sign off. We try to keep this at an hour, but we do really appreciate that you've shared your contact information at the Side-by-Side Brain Injury Clubhouse. You know, this is exciting for many of us. It's been exciting to watch this unfold over the last 20, 25 years. I know you gave a shout out earlier for Dr. Jacobs, but this has been a team approach across the East, and it's moving west. And we're really grateful to the United States Brain Injury Alliance. Our mission is to engage the community in preventing brain injury and improving lives. And you've shown clearly how the Clubhouse model is able to weave or braid funding with no small amount of effort, I have to say. I understand how hard that is to be able to maintain programming and accessible, affordable, appropriate services for people with brain injury as they move through a process of recovery and just living well. So Cindi Johnson, Executive Director, Side-by-Side Clubhouse, Colleen McKay, Assistant Professor and Director of PCR at Massachusetts Medical School. Thank you for joining us. I'm Jeffrey Lauer with the United States Brain Injury Alliance, and we will be emailing you, all of you, a link to this recorded webinar in the next 5 days, 5 business days. You'll be able to find that. And again, I encourage you to track down our speakers for more information, because that's how anything ever happens. We all learn from each other. And I'm so grateful, tremendously grateful, Cindi, for your efforts here in my neck of the woods and nationwide. So thank you all, and have a great afternoon.
Thanks very much.
Thank you.